Hi, welcome back to your prescription for medication education. My name is Enmi, and I'm here to bring you quality information regarding medications and try to make myself just a little bit better with every video. With that being said, I'll be continuing the mucosal dosage forms videos. Today's objectives are pretty straightforward. I'm going to be discussing the pros and cons of vaginal drug administration. I'll be covering the factors that are involved in vaginal drug absorption, and I'll be covering common vaginal dosage forms. The vagina is part of the female's reproductive system. It is a thin-walled, S-shaped muscular tube that connects the vulva, cervix, and uterus. The vaginal wall consists of three layers: the epithelium, the muscle layer, which is built of smooth muscle cells, and the external membrane filled with collagen. The epithelium is the inner mucosal layer and mostly consists of non-keratinized squamous cells. The epithelial layer's thickness changes during the menstrual cycle and is directly related to the person's age. Advantages to vaginal administration include its use for both systemic and local effects. It avoids the hepatic first-pass effect and avoids gastrointestinal side effects. Natural estrogens are 95% metabolized by the liver when orally administered. The vaginal route of administration allows for lower doses to be used and can improve drug adherence via the implementation of extended dosing regimens, which is often associated with vaginal dosage forms. Disadvantages related to the vaginal route of administration is the obvious gender-specific use and the hormonal variations that can occur in women, which can influence systemic absorption. Leakage of medication can occur via this route following medication administration, and its overall acceptance by the patient is based on cultural norms. There are several factors involved in vaginal drug absorption. Medications permeate the vaginal mucosa mostly by passive diffusion and to a lesser extent by active transport mechanisms. The vagina's epithelium is coated in a mucus layer, and the rate and extent of drug release depends on the amount of secretions. During ovulation, increases in volume secretion, viscosity, and pH occur. This can both speed up drug dissolution and slow diffusion. The vaginal tract has less enzymatic activity when compared to the oral route, so drugs requiring extensive hepatic enzymatic activation are poor candidates for vaginal administration. In healthy females, a vaginal pH typically ranges from 3.8 to 4.5. Lactobacillus species are dominant in the vagina, and they metabolize glycogen into lactic acid, creating an acidic environment. Rising pH changes occur during infections and menopause, which can reduce weak acid absorption and improve weak base absorption. About 95% of drugs possess an ionizable group, and of these, 75% are weak bases. Thicker vaginal epithelium, which occurs during women's reproductive years, impacts absorption by decreasing drug permeation. The ideal vaginal dosage form should be long-acting to reduce dosing frequency, be non-irritating to the vaginal mucosa. It should also be designed to prevent or minimize vaginal drug leakage and should be colorless and odorless as to not stain undergarments or affect sexual activity. The vaginal douche is a liquid that is introduced into the vagina and can be found as a douche bag or bulb douche syringe. The douche bag typically holds 32 to 64 ounces of fluid and utilizes a tube and a shutoff valve with gravity as the force of fluid pressure entering the vagina. The bulb douche syringe is available in disposable and non-disposable forms. Non-disposable forms hold 8 to 16 ounces, and disposable douche syringes hold 3 to 9 ounces of fluid, and the rate at which the fluid enters the vagina is controlled by the user's squeezing force. Liquid dosage forms are a poor choice for controlled drug release in the vagina due to rapid clearance and poor retention. Douching is not necessary for vaginal cleansing, and douching for routine hygienic reasons should be discouraged because it increases risk for vaginal infections, vaginal irritation, and disruptions to normal vaginal flora and pH. Ovules are vaginal suppositories that are typically oval-shaped or are shaped in a manner to facilitate insertion into the vagina. Ovules are designed to dissolve rather than melt. Dissolution occurs when water-miscible and water-soluble bases draw in vaginal secretions due to their hygroscopic nature. Ovules weigh on average between 3 to 5 grams. The bases used to formulate ovules can be water-miscible, water-soluble, or lipid bases. An example of a water-miscible base is polyethylene glycol, and for water-soluble bases, glycerinated gelatin is used. Lipid bases can consist of synthetic triglyceride mixtures such as Witepsol, which is a brand name for a type of fat used in ovules. Lipid-based ovules are designed to melt in the vagina instead. Hygroscopic bases may cause irritation to vaginal mucosa by pulling in water and leading to dryness. Lipid-based ovules can melt in hot environments, leading to a loss of shape, which can make it difficult to handle and insert. Vaginal rings are circular, flexible drug delivery devices in which the drug is embedded in a polymer network and is used to provide controlled release of medication in the vagina. The ring's diameter can measure 5.5 centimeters, and the rings can be made of polysiloxane or ethylene acetate copolymer. There are many types of ring designs. The matrix type of ring has the medication evenly distributed throughout the ring, meaning the surface of the ring releases the drug quicker than the core of the ring. The sandwich type of ring has a constant release of drug occurring because the medication is below the ring's surface, in between the outer band and the central core. The reservoir type of ring has the medication within the centralized core, surrounded by a drug-free silicone. Vaginal films are thin and soft flexible sheets that dissolve in the vaginal fluid. Films can be square or rectangular, and the surface area can measure 25 centimeters square. Films are designed to disintegrate within a few minutes. Vaginal films contain polymers, plasticizers, and solvents. Polyvinyl alcohol is an example of a water-soluble polymer used. Glycerin is a plasticizer, and purified water is an example of a solvent that is used in manufacturing of vaginal films. The film's strength and disintegration time varies based on its formulation. I'll be honest, I generally didn't realize films were used vaginally. Apparently, vaginal contraceptive films are marketed as a method for birth control, and they're 85 to 95% effective if used correctly. And if used incorrectly, its rate of success can drop down to 75%. Compare this to hormonal contraceptives, which can be 99% effective if used correctly. Vaginal tablets are like oral tablets in terms of formulation and manufacturing processes. Ideally, tablets designed for vaginal use should disintegrate rapidly. The tablet's vaginal filler of choice is important as well. Lactose is an excellent choice as a filler because vaginal microflora converts lactose into lactic acid to assist in pH balance. Bioadhesive polymers can be incorporated to create a mucoadhesive delivery system. These polymers interact with the vaginal mucosa to create a gel-like matrix, reducing leakage of medication. Examples of bioadhesive polymers that are used in vaginal tablets are carbopol and xanthan gum. Creams and gels are frequently used to treat vaginal conditions. These should be non-toxic, non-irritating, and easy to use. This dosage form is highly susceptible to leakage, leading to reduced contact time with the mucosa, lowering absorption. Gels are easy to spread onto vaginal mucosa, and due to their high water content can alleviate dryness by hydration and lubrication. Mucoadhesive formulations and thermal gelling formulations have been designed to reduce vaginal loss of medication. Mucoadhesive polymers create bonds with mucins which resist vaginal clearance. Some examples include carbomer, hydroxypropylmethylcellulose, and hyaluronic acid. Thermal gelling formulations form a bioadhesive gel at physiological vaginal temperatures. Chitosan and polaxamers are examples of thermal gelling polymers. Intrauterine devices are T-shaped devices implanted via the cervix and placed into the uterus. They range from 28 to 32 millimeters wide and 30 to 36 millimeters long. There are two types of intrauterine devices available. Contraceptive metal intrauterine devices, which have a failure rate of about 0.08% and are often associated with a heavier menses. They work by releasing copper ions into the uterus, creating a cytotoxic uterine environment, which is directly toxic to sperm and can also have secondary effects on endometrial implantation. Hormone-infused IUDs have a failure rate of about 0.02% and are associated with a lighter or absent menses. Levonorgestrel will cause the endometrium to become non-responsive to estradiol from the ovaries and begin to thin and atrophy, which reduces the chances of implantation and leads to decreased menstrual bleeding. It can also cause cervical mucus to thicken, which can affect sperm motility through the cervix. Insertion is painful, especially for nulliparous women. Lidocaine plus prilocaine cream, when applied to genital mucosa, has shown superior pain reduction when compared to NSAIDs, tramadol, and lidocaine paracervical block. And that was your dose for medication education. I hope you enjoyed today's video. If you did, please give me a like and subscribe. I would appreciate it. And as always, any feedback would be greatly appreciated. Thank you and have a great day.